Hello everyone.
Hello friends.
In this we are going to give you introduction about our new course which is to be launched in January 2024 on Swayam NPTEL platform. The course is Basic Certificate in Palliative Care. Myself, Dr. Geeta Joshi. I am Chief Executive Officer of Community Oncology Center and a Hospice in Ahmedabad. I am former professor and head of Department of Palliative Medicine at Gujarat Cancer and Research Institute, Ahmedabad, and also served the institute as Deputy Director till 2017.
I'm Dr. Yashwant Joshi, Director, Unnat Academy of Human Excellence. I'm basically a soldier, served in the army for almost about 35 years and did lots of learning. Started my learning with humanities, then I did my law. Thereafter I changed over to science. I did my MSc, then pursued management program, and finally I did my doctorate. Let me tell you that I do not have any medical background. And then you'll be surprised then how come you are in this particular medical field talking to us. Yes, my dear friends. I got fascinated by palliative care almost about more than 25 years back. When I came to know that there is a field in medical science which accommodate everybody around the patient, starting from the family members, friends, society, and to the uppermost crust, that is a specialist doctors and hospitals and everything, and that is called palliative care. And then I started taking interest, and then thereafter, lately, just few years back, I did a fellowship course in palliative care. I'm very active in palliative care because after taking premature retirement from the army, we had established an organization called Unnat, and I was just doing social service. And basically, in palliative care, social service is an important part of palliative care. That is how I am here in front of you. Then coming to NAPCAIM, we call it National Association of Palliative Care for Ayush and Integrative Medicines. Way back in 2020, I was attending an international conference of IAPC, Indian Association of Palliative Care at Guwahati. So me, Dr. Piyush and Mr. Radhakrishnan, we are talking about it, that why not try and integrate Ayush specialties with modern medicine. When I say Ayush means Ayurveda, Yoga and Naturopathy, Unani, Siddha and Homeopathy, all these our heritage medicines, can be amalgamated, can be merged, or some sort of can give complementary support to the modern medicine. And that is how NAPCAIM came up. We are about 3 years old and headquarters is located at Lucknow.
So NAPCAIM was established in 2020 and with the aim to integrate Ayush, the 5 specialty of Ayush. 6th is complementary medicine and 7th is modern medicine. That is why you see a picture of Saptarishi on right side of the slide. That with this 3 integration of this 7 specialty, we want to enhance the services of palliative care and for betterment of patient. The aim of
I like to tell you, in Vedic time, all these rishis, they are basically philosophers, and some of them, they were the surgeons, doctors also. Yeah.
Yeah. So the aim of this association NAPCAIM is to create awareness of about health and well-being, and it is aimed to reach out to everyone practicing palliative care. It is also aimed to highlight the practices of palliative care in resource poor setting, which is very rural area of our country where palliative care may not have, patient doesn't have access to palliative care. And finally, to involve all, to everyone who can practice palliative care, including communities, and to promote training, research and practices. So the final aim now, let's go out and create opportunity to all to practice palliative care and to relieve suffering of our patients.
You see, we means NAPCAIM, National Association for Palliative Care of Ayush and Integrative Medicine, came up when Corona time was there. During Corona time, one could not move out. So what to do? We wanted to go ahead. We wanted to do certain things also. We wanted to progress further. And that is how we came up with the idea of International Institute of Distance Learning, that we established that, and through this IIDL we started running online courses, and Dr. Geeta Joshi, she is the director of this particular institute.
So International Institute of Distance Learning is a NAPCAIM training division under which we have number of courses. The duration may be few hours to 1 year as well. And these courses are self-learning courses, online courses. One can learn through Google Classroom. Secondly, there is an opportunity for hands-on training as well. In our group, we have people who have got their own establishment of palliative care where students can go and have hands-on training. Thirdly, there is a definite benefits given to the NAPCM members who wants to do these courses. We also organize conferences and workshops. Recently, since last 2 years, we had 2 international conferences. The last one was organized at Kochi in first week of October. We have given opportunity to many students who are practicing palliative care. By doing these courses, they enhance their practice in palliative care. That is what the aim of IIDL is. For further information, you can visit the website of NAPCAIM. All these courses are upgradable courses. So even if you are doing a first course, for second course you need not repeat the first course and your certificate will be enhanced to the next degree of the course.
Now this is, I spoke to you, this is regarding our last course. Again, Swayam portal under National Program on Technology Enhanced Learning. That is called Foundation Certificate Course in Palliative Care. Again, about 12 months, 12 weeks. And as you can see, more than 1,000 students attended, about 400 students registered, 367 passed the test. And out of 367, about 95 got the gold certificate. That means they were very meritorious students. So you also, I request that attend this particular course and go through it. It's a matter of just 12 weeks.
There is a provision of internship at end of this course, and internship will be offline. It can be 4 to 8 weeks duration, and the student will also get stipend during the internship.
Offline courses and NPTEL Swayam courses. Offline courses, palliative and geriatric aid course. It is offered by one of our hospices, Koshish, located at Jharkhand. Farishte, a course on death and dying. Again, it is being offered by our hospice, Koshish, at Jharkhand. And third is hands-on training and NPTEL internship at Community Onco Center, Ahmedabad. And under NPTEL Swayam courses, now this year we are again going to rerun the last year's course, that is Foundation Certificate course in Palliative Care. 12 weeks, it will start from January 2024. And this course, on which we are recording all these contents, basic certificate in palliative care. That will also start running in January 2024, 12 weeks. Now let me give you certain additional information about this course, ongoing course, basic certificate in palliative care. Domain, palliative care, it's a medical domain of NPTEL program, Swayam portal. Duration 12 weeks starting from January 2024. Faculty, we have got expert faculty from the domains of NAPCAM, and they are all palliative care qualified people, lots of expertise, so many years behind them. Course, it is elective and it's a certificate course. Audience, it is helpful for medical professionals, paramedical staff, volunteers, caregivers, and anyone interested in health and well-being. I want to emphasize anyone interested in health and well-being, everyone. I mean, so all of us want to live happily, healthily, and therefore this is the interesting course which you can understand very easily. Methodology under Swayam portal, that's self-learning portal, delivered through Google Classroom, and this time we have increased the credit hours. Anyone who registers and passes all the 12 assignments will get a certificate with 32 credit hours, which will be very helpful in their professional careers. Now I want to tell you few points. Please remember, I do not have any medical background, therefore I am requesting, I am urging you people. If Dr. Geeta Joshi says something, you may not believe her. But please believe me, take my words. The course is for everyone who is interested to learn about palliative care. Anybody who is interested in personal well-being can take this course. Even a family member should know about it, because palliative care is about total care, holistic care, and it includes important aspects like social, cultural, psychological, spiritual, and community participation.
So Yashwantji, do you mean that even housewife or a home manager, I will say, should do this course?
Yes, 100%. If they can, you see, presently we are giving out this course in English language, but later on it is going to be translated. So anybody who has got some knowledge about English and can understand what we are talking about can take this course. Anyone, there is no embargo.
One thing I want to assure you, that whatever you learn from this course is going to be with you till as long as you are on this earth. This will be useful to you if you yourself is falling sick, or somebody in your family, your loved one, your friend or a neighbor, and you want to reach out to them and be helpful to them. Whatever you learn from this course will be very, very useful to you. So anybody who has got attitude to serve the society or serve the humanity should do this course.
I assure you, dear friends, that the contents and delivery of the course lecture is very simple, so that a lay person can also understand. The palliative care, even a caregiver or a family member has the rights to take part in the whole process of diagnosis, treatment till the end. So have no hang-ups. Please understand this. Learn it at least for your sake, for the sake of your family members.
The course is divided into 12 weeks. Week 1 has 2 credit points, and it is Introduction to Palliative Care, which has again got lectures. Few of the lectures are revision of the previous course, and basic content of the lectures are oriented with the basics of palliative care, community participation and communication skill. At the end of any week, you have to do an assignment. Along with these lectures, you are also given reading material in form of reference material, which you can open up the files and read yourself.
Week number 2, 4 credit hours, it is regarding advanced communication skills, and the following lessons will be taken up. What is active listening? Are you really listening? Active listening skills, communication skills for health professionals, and communication competency for health professionals. And last lecture is about talking about death.
In week 3, you will get 2 credit points, and the subject is psychological distress. Here you will learn the psychological aspect in palliative care. What is psychological distress? The types of psychological distress, Kessler psychological distress scale and another scale as well, generalized anxiety disorder, and guilt and regret. These are the lectures covered in week 3.
Week number 4, 2 credit hours, socio-cultural and spiritual issues, cultural aspects in palliative care, spirituality, certain frequently asked questions will be answered over here in this particular lesson, spiritual distress, and will show you certain ways to lead spiritual life.
Week number 4, and again
5.
Week number 5, again 2 credit hours, and here you will be taught about stress and burnout management. Health professionals who are into palliative care are likely to have lots of stress, and they may burn out with many symptoms in their professional life. So you are going to learn about what is stress and what is burnout, some tips and on the management of the stress. Then burnout in healthcare professionals will be narrated. Avoiding burnout in healthcare professional will be taught, and volunteers to prevent burnout, that is one of the subject. And of course self-care, how you do self-care to prevent burnout in yourself, that is how everything is included in this week 5.
Week number 6, it is about post-death psychological support. It is about 4 credit hours, ethical aspects of end of life, and thereafter we'll have impact of bereavement on family and friends, Kubler-Ross model about bereavement, theoretical aspects, models of grief and bereavement, psychology of grief and bereavement, and how to manage grief and bereavement.
Week number 7, 2 credit hours. Here we will be teaching you about pain management with opioids and adjuvant drugs. What is the importance of pain whenever you are treating a patient? That is the basic aim for you to learn. We will be talking about metastatic bone pain management, how to prescribe essential narcotic drugs which are very important to treat moderate to severe pain in palliative care patients. Safe use of essential narcotic drugs. There will be a lecture on neuropathic pain and its management, and there will be introductory lecture to the intervention of pain management.
Week number 8 with 4 credit hours, it is regarding symptom management. We'll be talking about gastrointestinal symptoms, respiratory symptoms management, delirium and dementia, emergencies in palliative medicine, and lastly we'll discuss about recent advances in nausea and vomiting.
Week number 9 will have 2 credit hours. Here we'll be teaching you advanced nursing care. Nursing care is very important part of palliative care given to any patient who is suffering from chronic diseases. There will be nursing care plan case scenario discussion. Bladder and bowel care is one of the lecture. Another 2 lectures are on stoma care, part 1 and part 2, because there are various stoma on the body of the palliative care patient, and which you as a nurse you have to take care of them. And lastly, we'll be talking about skin care in colostomy.
Week number 10 with 4 credit hours. The title is Care of Dying. We'll start with importance of prognostication, thereafter diagnosing the dying, facing death, how to help, and lastly we'll speak about subcutaneous route.
Week number 11 will have 2 credit hours. Here we'll be talking about government schemes for palliative care. There are number of government programs under NHM which are basically meant to enhance the palliative care services at government setup. So firstly we'll be talking about National Health Mission, then Ayushman Bharat. The now palliative care services are also covered under Ayushman Bharat. Government scheme for palliative care. Then we'll be talking about NDPS rule 2015, and lastly delivery models of palliative care in India.
The final, that's week number 12 with 2 credit hours. It is regarding availability of ANDS. ANDS means essential narcotic drugs and advanced directive. The first lecture will be about availability of ANDS in India, then availability of ANDS and advocacy, euthanasia, advanced directive, and then we'll be talking about history of opium in 2 parts, part 1 and part 2.
So this is in brief about the 12 weeks course you are going to learn on a basic certificate in palliative care. Anything else, Yashwanji?
Yeah, I just want to tell all of you, everyone, that this is a journey, a very short journey, a journey of 12 weeks. And all of you who are really interested, who want to know something, forget about palliative care. If you are interested about well-being of your body, of yourself, of your friends, families, then this is the subject and this is the chance what you are getting. Just devote 12 weeks and I am certain will be a very wiser person and will be thankful to us that we told you, we rather persuaded you to do this course.
So you mean to say one remains a student throughout the life?
Yes, right? That's the motto of my life. I told you how many streams I did. I started with BSc, then did BA, then MSc, and then finally law, PhD, and then I came down to palliative care, MBA. So many things, and still I am learning. I am learning from everywhere. I always say that when you cease to be a student, you cease to be a human being. We are human beings, not animals, so we keep on learning, and this is the subject. An opportunity has been given to you by a Swam portal, Government of India. Please do avail it, and I am very sure that you will be really happy.
Spread the word about this course to your friends as well who are interested, and pursue them doing this course. Thank you very much.
Thank you all.